Okay, so let's get started. Thank you everybody for being here this evening. This is our Transformational Healing Seminar, and the most important thing about the seminar is that, what is it? You've been here many times now, Andrew.
Yeah, but I haven't been here in a while.
That's right, but why? Why do we have these seminars? Like, you know, you could be doing a million things right now. You can walking the dog, hanging out outside, you can watch TV, you can watch a bunch of shows, you know, you can get on your computer. Why bother being here? What's the purpose?
So you understand what the treatment, why we're doing what we're doing?
Okay. So what you're saying is that so we can understand the reason for why you're getting adjusted, right? That's one reason.
Or some of the technologies, for instance, today.
Yeah, the technology, for example, the laser. Good. So one thing is obviously knowledge. What else?
Well, I want to see whether this treatment is something that would be effective in dealing with neuropathy.
Neuropathy. Okay. So everybody's so far talking about, and you know, you're in a doctor's office, obviously, you can be looking for conditions that can be helped, right? And that is totally amazing, and it's true. The most important thing why we do this is for us to share the principles. Question for you. How many times have you gone online or read something that claims this vitamin is good or this procedure is good, and the next page you read is what? Totally opposed to what it said, yes?
Mm-hmm.
So how do you know what to believe then? So here's the thing. The most important reason why you're here is to share with you principles. Principles are going to be the filter that you can use to filter out proper information. Because I can't be walking around with you guys and protecting you all day long like you with your kids, right? You need to teach them the principles to protect themselves, yes? Guess what? Do principles change or are they eternal? What's that principle?
They're
That's
eternal.
gravity.
What is this? What is that? What'd you say?
That's gravity.
What's the principle?
That's eternal.
Right, but what is it?
What goes up must come down.
Yeah, does it ever change?
No.
No, it's always there. So tonight, our goal for you is to understand the principles of how the body works, and so you can navigate yourself no matter who's saying it, I'm saying it, the TV's saying it, drug companies are saying it. What are the principles that you need to understand so you can navigate yourself? You have your own GPS, right? And also to give you hope. You understand, because if you understand how these things work, then you can then give yourself an opportunity to filter things out. So our mission is to inspire people to live extraordinary lives so they can be a beacon of hope for others. What is that? How does that speak to you, Jake?
Sounds nice. It sounds promising.
But pick one word out of there that you feel like, you know what, how can that our practice
Hope.
be? Hope.
Yeah.
Yes.
Yeah.
How many people do you know before you guys get here that you've tried many different things and you end up losing hope, right? Andrew,
Sure.
what was your situation before you got here?
I had severe pain in my toes
Okay, and who'd you go to?
and plantar fasciitis.
And who'd you go to?
I went to a quack and
Stop it, be nice.
that is being nice.
So you went to the traditional doctors, right?
Yes.
And then what did
I
they
went to the doctor for the Philadelphia Eagles.
Okay.
I'm
And
not sure how they won this year with that doctor, but
so funny. And then they couldn't help you.
no.
Right. And then you were like,
No, he had the nerve to tell me when I walked in there, he's like, you know where you're at? He's like, this is a sports medicine place, and you really shouldn't be here.
yeah, okay. All right, I'm sorry to hear that. But anyway, that's one of the stories, in other words. So again, we're not here to try to compete. We're here to get to the root cause. Make sense? So hope, inspired to have hope, because we're going to share that as we go through the seminar tonight. You guys know who this guy is? Dr. Jeff Spencer. He was the Tour de France chiropractor. This is when I met him back in 2008 when I still had hair. And I met him through over the years, and he was instrumental in getting this Tour de France riders. It was the Discovery Channel team. Back then, there was a Radio Shack team. Remember Radio Shack?
Mm-hmm.
Right? And the Postal Service team.
Hey, they're still in business.
That they're still in business? That's what
Online.
you were
There's
telling
one,
me.
sorry, there's one Radio Shack store out there.
That's it. Everything else is
Everything else is online.
Okay. So he was able to get those riders to 7 Tour de France's in a row in first or second place. And when he taught us the seminars back in 2008, he had his heyday. He'd already learned, you know, he didn't really care about being famous, working with all these high-level athletes. So he started teaching it to us, and I was front row, learning everything that he said. Got these riders at the top level to function properly. Because you know what? Even though none of us are like, we don't get a yellow jersey at the end of 3 weeks, we still deserve the kind of quality care that he provided these guys, so we can navigate our lives and have hope and enjoy ourselves. Also want to thank Dr. Kirk Gare. He's one of the teachers for Erchonia lasers. He's been around for a long time. He shared many of the research papers that we share with you today, and the slides are from him. So the laser is also referred to as the photobiomodulation. It's a fancy term that tells you what the laser is. We're going to present research tonight, and the laser we use tonight is the non-thermal laser. There's different lasers out there, right? It's actually Erchonia laser. It doesn't heat up or anything. We're going to talk about the mechanisms and how that works. There are other lasers out there that use for pain relief, but that could be very, it could be damaging if you don't know how to use it. But the Erchonia laser would not allow you to.
What is the light? Is it infrared?
No, it is not infrared. It's actually coherent light. We're going to talk about it in detail in terms of, that's what the seminar is about. We'll go deep into what it does. So if you want more research, there's a research called Energy Medicine, the Scientific Basis by Dr. Oshman. He talks about how lasers work. It's a coherent light. So everything in life is made out of light. It emits light, right?
Define coherent.
Coherent, that means it's actually coherent as opposed to, broken up and so on. So when there's coherence, that means there's harmony. Okay, incoherent, that means it's like when you're not coherent, you're not communicating properly. So we'll go into details about what it does and the applications too on a day-to-day basis then. Consider the language of the cells. LED light is non-coherent, and when it comes to the studies, this is actually what we use the LED for the sham, in other words, the control. Okay, so a lot of times you can probably see that a lot on like social media. They go, oh, we're doing red light therapy. Not all red light therapy is the same, and we're going to talk about that this evening. The laser has been used in Russia for many, many years in all different fields of medicine since the 70s. All these specialties. Right? We're just beginning to catch up now.
I've heard of red light therapy, but how does what you have differ from the stuff you can buy off of Amazon?
Yeah, exactly. And we're going to talk about that for the rest of the evening here.
So I'm ahead of you.
Yes. Yeah. Everything that you're going to, that's the reason for the seminar, is that we're going to get to the bottom of everything that you talked about. Dr. Murphy is the one that started using lasers back early in the 80s. And basically, he said you should be using lasers for your brain. And what it does, it cleans up all the junk, basically, in your brain. It enhances neuroplasticity. It reduces inflammation. It improves cognitive function by using the laser in the brain on a consistent basis. And again, it's non-thermal. So when you use it on your brain here, it actually helps.
Is that where the laser is applied?
In many ways. It's one of the ways the laser can be applied. Okay, and this is summary of the effects of it. So BDNF, that modulates cells so that the body can actually help get rid of old junk in your brain. It's one that can use hepatic growth. The laser can actually help inflammatory activity during hepatic degeneration in the liver. Also, several types of cells proliferate by using the frequency of 628 and 6 nanometer frequency, and it actually allows wounds to heal. So again, the coherent light, the studies right there, phytobiotic low levels therapy, and here's some of the summary here. So when you use it for the brain, it decreases inflammation, it stimulates cells, also in the bone marrow and the cranium. There's no thermal effect like number 4 lasers. Again, there's a whole mechanism of how things work. It increases lymphatic drainage. It increases blood flow to the area. So when you look at the laser, what it really does, in the bottom line, it stimulates mitochondrial ATP. You guys remember ATP from biology? That's the energy center of your cells. So the mitochondria is what creates energy in your body. So when you shoot the laser, the certain frequency of 635 nanometer, then it actually stimulates mitochondrial ATP and the body repairs in a much faster rate. Okay.
What makes this laser capable of going through the bone in the skull?
Because then you don't, because the frequency, think how fast is light? 186,000 miles per second,
Yeah,
right? And also each of the photons in here, each of the diodes has 40 billion photons that hit. So again, it's not about the depth of penetration, it's about stimulating the mitochondria. The mitochondria travels all throughout your bloodstream and it travels all throughout your whole body. Okay, so part of the way that we can use laser is using for concussions. Concussive syndromes, we take care of a lot of kids, just tons of, here's another thing too. You'll notice like with athletes, when they get concussions, they start to get gut issues because of gut-brain axis. The gut and the brain talk to each other. And then when they get gut issues, the body produces hormones that affect the brain. And then next thing you know, you got depression going on back and forth. And the laser can definitely help with that. There's actually, we can balance the cranial nerves. The 12 of the cranial nerves, that when you use the laser, we have a very specific protocol. We take care of a lot of athletes that have these concussions. They get concussed again and again and again. And it actually, it's not good for them because then even if they're not traumatized, nobody ever fixes the brain. We can use the laser to do that. Again, you have a whole mechanism of how things work and how we can actually help get that brain to repair itself. It dampens free radicals, it improves blood flow, and again, increasing the ATP or adenosine triphosphate is what allows the body to repair. Here's the thing, the laser's accelerating the capacity of the body to repair because you're using coherent light, right? And a very specific frequency, which is 600 something. Here's the thing that we talked about. So this was your question here. So there's vascular channels that connect the skull and bone marrow and the brain surface. And it actually penetrates because you're allowing the stimulation. It travels all throughout your whole body. And again, you're not looking at like a flashlight. Another thing, so some of the studies show that with Parkinson's, right, there's some studies on there and how you can use the 635 nanometer class 2 laser, which is what the Erchonia is, to help with Parkinson's just way back in 2009, 16 years ago. Autism. See here, you can see the studies, the Erchonia spectrum laser. Erchonia also has the 24 FDA clearances, by the way. That's why we use them, because they're very valuable. You can see the brain, the different before the laser in terms of the increased blood flow, so that the brain can actually repair much better. All of these are all in Erchonia. If you ever want to get deeper into the research, they can provide this for you. Here's the thing. I don't know if you guys remember the Krebs cycle. That's how your body produces energy. Anybody like that in biology and try to remember all these pathways? So the beginning of it up here, if you look at that here, that's called the electron transport chain. We can get deep into this now in terms of how the laser works. So when the laser hits these things in the mitochondria, it stimulates a whole cascade of energy, right? Like the electrons get excited and the energy. If you think about what your body's made out of, it's made out of electrons, yes? So what the laser does, it hits those electrons, gets it to a higher level of functioning. And so there are different types. So for example, the one we use mostly is the complex, the 635 nanometer frequency, the red laser. It actually helps here with the step 4 in the electron transport chain. We also have the violet one, which is this, right? That actually helps with complex 1, complex 2, in terms of how the body functions. And then the green one is that's being created right now that this came out, actually helps with the complex 3. So the electron transport system, again, helps create energy in the body. So when you have more energy, let's say you have your business, if you have more money into the business, does it do better or worse?
Does better.
Yeah, exactly, because then you can do more things. It's the same thing with the body. When you use the laser, it stimulates all the complex 1, 2, 3, and 4, and it gets the body to function the way it's supposed to. Okay?
I have a question.
Mm-hmm.
Are we talking temporary, or are we talking something that is corrective permanently?
Well, what you're doing is getting the body to repair. The body's always repairing, right? So if you have, we'll talk about different outcomes here in terms of different symptoms and the application of all that. And again, it's about getting the body more energy. To answer your question, if you have a business, if you have more money coming in regularly, you have more affluence, and if it stops, right? But again, it's more applicable. This is part of there are different frequencies that you can use. Can you see this? Yeah, parasite, yeast, wart, chronic inflammation, scar tissue, wounds, joints. You can program the laser in many different factors. Okay. What's the problem when you inhibit the electron transport chain? So guess what inhibits these electron transport chains? Painkillers, aspirin, all these other drugs, right? When you mess up the electron transport chains, you mess up the mitochondria. What are the mitochondrial diseases that are being affected? Look at that. Kidney disease, aging, vascular disease, pulmonary issues, neurodegenerative, cardiac, cancer. These are all as a consequence if the mitochondria are not functioning the way it's supposed to. So when you use the laser, remember that? It stimulates the mitochondria to produce more energy so the body can repair. So these things mess up the complex 1 and 2, all these medications that people take, right? And now it messes up the system where it can't function the way it's supposed to. These medications enter to mess up the complex 3. Additives, food additives, lifestyle factors, it messes up all the different factors in the body. Chemicals, sweeteners, all these things mess up the whole system. So surgery, a lot of people we use the laser. We rent this out. Let's say somebody's getting knee surgery or any kind of surgery. There's a frequency called the post-op. You use the pre-op. You do a day or two before, and then you do the post-op. So this is me. I always experiment on myself. This is my periodontist. So I had a tooth that cracked open, and got cracked. So he took that off, and then also he did an implant. Right. There's the implant right there. And as you know, that's major surgery. So that evening, he wrote you prescriptions always. Get the Percocet, whatever, Tylenol, or antibiotics and so on. So in my case, I had those just in case, but I used the laser in different frequency, the wound frequency, right? And also acute inflammation right there. And then I also used the nutritional protocol. Sound look familiar, Andrew?
Yes.
Right? That's all the nutrients.
But that's technically willow bark, which is the same thing as aspirin.
Right, except it's not synthetic.
Okay.
When you do something that's synthetic, then the body doesn't have all the,
Willow bark is
enzymes.
aspirin.
That's what
salicylic acid.
That's why they come out of. So can you see this? So they have the omega-3, the magnesium, all these other things. The nutritional protocol to help reduce inflammation, and along with the laser. I got a fight with my cat. I always bring the laser home with me. That was right before, and that, look how quickly that, you know, clotted, and that's only like a couple of minutes afterwards. There. Actually, is this thing volume on? Where is the volume on here? Okay. So, athletic injury. I was doing karate. This was probably like maybe a year ago. And we were doing these kicks, and I felt something rip in my hamstring. So I went right over to the corner, and I taped myself up. I put the laser on there, and I was really, really surprised. I thought, I always carry the stuff with me that I try to help athletes with. Put the laser on there, and then there's part of it there. Where is the volume in this? Oh, darn it. Oh, there it is, volume. Okay, it's already up. So I did a laser on myself, and then a couple days later, I was able to compete again. So, you know, I'm always using this on myself. Fractured healing, you can actually increase the healing of a fracture by over 60% if you use the laser right away, because it stimulates bone, right? And again, all this research is right there. Effects of pulse frequency of low-level laser on bone modulation.
Is this being used in medical facilities?
I don't know. I know we use it in holistic facilities. I don't think too much in the medical facilities that are like traditional.
What's the reason?
I don't know.
Money.
I don't know. I don't know. I just know that I stay on my lane on this side here to take care of people. Athletic performance improvement. Again, low levels improve VO2 kinetic. The competitive cyclist. It basically increases your capacity to recover and also to perform. There are many non-thermal injury exciting sports recovery. So again, reduces inflammation, increases the cell. The bottom line is you're giving the body energy so it can do what it's supposed to do instead of telling it what to do, right? In emergency medicine, it's almost like you have to tell the body what to do because it's like broken. But what we do in the holistic approach is that give the body what it needs so that it can use, it's again giving it currency so it can repair faster without harming it. Wound healing, randomized clinical trial, accelerated wound healing, using lasers, post-operative sports, early return. Again, the bottom line is when I take care of athletes, anybody want to be like sitting on the sidelines? Like you want to get back on track, on track right away. So that's another way we could do the neuro recalibration, right? So we do this with you guys, do the ranges of motion, and if it goes weak, and then you use the laser in that area, it turns the breaker switch back on, and then you check it again, right? And it still goes weak. You laser it, again, it's turning the software back on, restoring communication between the tissue until it gets strong again. And that's the neuro recalibration that we're talking about. We can also use it, remember the ServoGuard, Andrew?
I haven't gotten mine yet.
Okay, right? So when we use that, we're going to do what's called stacking. We can actually stack using the laser to try to make change, with the neck area. So when that arrives, so this is the big laser that we have here. We have like 5, 6, 7 different ones. Oh, I know why. Can you give me the remote control under there here? It's right over here. Okay, no, where is it? It's right here.
There you go.
Yeah, I was wondering why there was no volume. Okay. This is right on the field. So this guy couldn't play anymore. His shoulder was hurting, so I put tape on it.
That feels good, actually. Usually it feels painful once I bring it back.
That's the whole point. You don't want to play injured because your brain keeps sticking that picture of it. So if you can play injured, but you can tape it and get the body aligned, and you can heal.
It feels truly a lot better. Thank you. Cheers.
And that's what I love doing right on the field there, because you can really help these guys, repair like right away.
Dr. Mariano here, doing the laser to help.
These guys are like, they're like killed themselves, like bleeding all over the place, and like kids.
This is what we do in our practice, sports chiropractic.
And also, again, we use a lot of the athletic kinesiotaping. So let's say you have neck issues, right? And then we're adjusting you, we're balancing your cervical spine. Well, sometimes there could be some adhesions in the area or fascial adhesions, so we can clear those out using the rock blading, the kinesiotape. You haven't gotten to that point yet, because you're still early in your care. Down the road, that may happen, but that can actually make a difference as well. I don't want to get dinged by YouTube there, so. Okay. And also the vibration plate. So have you guys ever seen that before? The vibration plate. So the vibration plate vibrates you this way. So all your cells are kind of doing this, and you can stack it when you can use the laser, right? And then the body can then heal and repair a lot faster. Again, giving it currency. And doing different movements and so on. Many applications for it. Microbial infections. See the violet laser? Right? See how there's red and there's violet? The violet is 405 nanometer vibration. Pulse blue light. This is in PubMed back in 2021. It activates 2 types of coronaviruses. We use it a lot with like virus, bacterial, sinus infections. Anybody that has like infections that won't go away, we use the laser, right? And again, we have different frequencies that we can use. Oh, this kid, this is a long time ago. He is now 18. This is when he was 3 years old. He's one of 5 kids. He had this big wart on his hand, right? You see that?
This is Ryan. How old is Ryan?
You're the youngest guy. They're making fun of you.
Hi, Ryan. You're 3. Here's a wart in your hand. Today's the 20th of October, 2010. I'm going to use the cold laser on it, and we'll see what the outcome is.
So, this is later on.
It's a much clearer camera too. What's today? Today is June 24th, 2011, and this is follow-up on Ryan's thumb. I'm getting really close. I still really close. Nothing, no wart. There you are. Hi. Say hi. And still no wart. Just 2 laser treatments.
We did it twice.
Cool stuff.
So, to answer your question, it depends what the condition is. Make sense? Bone healing, it's going to accelerate it. Infections, it's going to accelerate it. Warts. This kid is 6 months old. You'll see in a minute. Not crawling properly. They took this kid to the, children's hospital, and they said this kid actually had torticollis. He was born like this, right? So they said, well, that'll resolve, but it didn't. So this got better, but then it went down to the lower spine, because the body's like a spring. When you start twisting it, you have to release the tension. If not, it goes somewhere else. But now the hips aren't moving properly. They said they'll outgrow it, but we took care of the kid. Can you see that?
Yeah, just
So we have the percussor. In the end, laser is one of the tools. Releasing all the fascial tension. And most important thing, you got to open up the nerve channels. The brain has to talk to the body, or you're just wasting your time. And that's 6 lasers later. Adjustments. See that? So that mom was like a first-time mom, right? And what do you think her life's now compared to what it would have been before that? Going to PT, doing all the different things. That was like 6 adjustments over a couple of weeks. Ear infections were huge in terms of helping these kids with the ear infections. So again, you use the laser to help the inflammation. Oh, this dog, this is not my video, this is from a veterinarian. It got hit by a car, and the owner brought it to the vet saying, can you fix it? It's like, you know, no, just put the dog down. I don't want to pay the money. I think it was going to cost like $800 or something. Like, just put the dog down. It's like, all right, we'll just take care of it. So the guy just left. So we couldn't walk. They adjusted the dog and they used a laser on it, right? I mean, that guy, the guy's like, you know. Yeah, the doctor of the vet actually happened to be also a chiropractor. So open up the nerve channels using the adjusting instrument. And then with the laser along with that, the dog was able to walk. So, Bon Jovi, you guys know the guy?
This four-headed laser is aimed here at my cords and the vagal nerves, and what it does is it stimulates blood flow, trying to alleviate as much inflammation anywhere we can. There's 3 different vocal coaches, there's a couple different lasers, there's a boatload of vitamins. If I can't be the therapist,
Right? So these guys know what works for them. They don't mess around. That's their life. So that's what we do with the laser. There are many different things that we can use it for, and the way we use it in our practice is to hold your adjustments better. Right? When we do the upregulation, the thoracic upregulation, cervical, the lumbar upregulation, like all those things that we do on the software level, it's to hold the adjustment. But the bottom line is the adjustment is the most important thing. Next time we're going to talk about kinesiotaping and how you can actually use that, especially you if you're going to be out in the field and trying to help out to make your spine stronger. Same thing with you, Andrew. I think we've done that a couple of times. That's our seminar next week. Everybody online, a few more minutes here. Please connect with us. If you have any questions, there's a QR code that goes to our website, and we can answer any questions for you by email. Oh, we have a Patient Appreciation Day coming up, and what we're doing here on the 19th of March, which is next Wednesday, we have several spots on there that's available, and we're giving people a discount. Instead of $295, it's going to be $97 to get a whole evaluation. Does anybody know where Chester County Connect is, who they are? Okay, Chester County Connect is an organization that helps women that want to put their kids for adoption, right? And so they help them with like formula and diapers and so on, so that they can bring the baby to term and then put them for adoption. So we're going to be donating our proceeds there to them. And for you that are in our practice, you get to participate in all these different experiences, and you get points, and here's your reward here. If you get a grand prize, you get an 1.5-hour massage. You also get Franklin Auto Spa donated, 5 car washes worth $100, and also an Amazon gift card. And we have other businesses that have donated to us as well in our practice there. So feel free to participate in that. The most important thing is the quality of the health and adaptability and resiliency is really proportional to the communication between the brain. You can use the laser on the body, but if you're subluxated, are you going to get the best outcomes?
No.
No, because the message, the communication is the most important thing. The principle, here's the principle that we want to share with you. If you have no subluxations, the brain, the cells, right, are going to communicate 100%. When you have misalignments in your spine from what kind of stresses? Physical, emotional, chemical stresses, guess what happens? The messages don't get through. And then the expression of life becomes inhibited because the body can't repair itself. How many guys do you have working for you, right? Imagine if your walkie-talkie and your things, the phones don't work. Can't get the work done because there's no communication, right? Same thing with you guys. So 100%, the most important thing is communication. And that is the foundation of our practice. Restore communication. It's unlike anything else. We're not trying to repair anything. The laser is only going to be beneficial if the communication's right there. And that's really the bottom line. Because this baby is a 1-month-old baby, was brought to mom. She was in Florida. She's not the patient. The patient is her mother, who's in her 60s at that time. And the baby has colic. Is colic good or no? What do? They never sleep. They cry all the time, scream and yell. Baby only slept for the maximum of 2 hours each time, right? So this is a short video of what we did. with our adjustment. But watch the tension. See how much tension is holding? It can't really calm down. So we just made an adjustment. That was the adjustment we did. It's going to release. It's going to turn. Watch. And look. It's done. So that is what we do. The principle is what? If there's communication, there's healing. There's no communication, healing can't happen. The laser, all these other things, kinesio taping, the nutrients, these are all important. Exercise, diet, everything that you do is outside in. The healing comes from where? Above, down, inside out. And that's really what matters. So our hope is that you get the opportunity to share that with everybody else, and not only for you, but for your family and friends as well. So thank you so much for being here this evening. Until we see you again next time, I'm Dr. Dennis Mariano. We'll see you soon.
Thank you.
You're
Thank you.
welcome.